Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
So welcome back. Today we're going to talk about smile design.
Yeah, today we will talk about smile design and the process that we take at LA Dental to do that. And why it's a really important part of the cosmetic sort of makeover on your teeth that you might want to do.
Right. So can you think of any recent patients that you've done smile design for, and why did you do that?
Well, we do smile design on every single patient, and we see several cosmetic cases a week. So one of the main reasons we do it is so that I can align what I believe we need to create with the, mental idea that my patient has. So it's a really important part of me understanding and being able to verify that what the design that I'm creating for their teeth is satisfactory to them and it's the thing that they want.
Like what they have in their head is actually what's going to be their final
in
result.
Their mouth. Yeah, and that it actually is going to look good. So there's two parts to that. Sometimes people will come in and say, I want really square teeth. I want them all to be exactly the same length.
Right.
And honestly, that's not a natural look and doesn't look good on anybody.
Right.
But that's an idea of what a Hollywood smile might be to someone. So sometimes it's about showing them that that's not going to look good in their mouth.
Right.
And sometimes it's really understanding what they want. So,
yes.
Yeah.
And that's a problem that we see, is that people come in with veneers, but they're not happy with them somehow.
Yeah. So we had a patient just a couple of weeks ago, and she had bonding done, I believe, a month ago. So about 2 weeks before she came to see me, she had bonding done on all of her teeth outside of the country. And she was just devastated. She didn't like them at all. Didn't like how long they were. They looked too long for her face. She showed me photos of herself beforehand, and it had really changed what she looked like. It changed her face too much. And so we ended up being able to really use that same bonding, but cut it down significantly till it kind of fit the framework of her mouth and her face.
Right.
So that's how we resolved that. But the bigger issue here is that she didn't have a trial smile. She wasn't able to go in and kind of see and verify that she liked the shape of the teeth that they were going to create.
Right. So the smile design is really like a trial smile, like what you're saying. Like
Totally.
We actually try it on you before we do anything. Before we touch your actual teeth, we try it on.
We try it on, yeah. So the process is you come in for a consultation and we just have a discussion about what do you want to get, because I might look at somebody's smile and think it's perfect, but then they might tell me these little details about it that they want to change. And then I'm assessing whether what they're asking for is realistic,
Right.
Is it something achievable? Can I actually, quantify what they want? Can I see it? Can I see what
Do they
they're
have
saying to
mental problems or dental problems?
That is a real issue.
That is,
and, and it's one of the main reasons why sometimes I deny service to somebody, because I see that what they're asking for is not truly something dental.
It's not realistically possible to do some changes just through changing your teeth. Like we do have people who want us to do like plastic surgery on them by fixing their teeth.
Yes, that does happen. Yes, so
that's not going to work.
To a certain extent,
a little.
When you change your bite and you expand your arch and stuff, it can actually seem like you had some Botox and filler done. Which
but it's not going to take away your wrinkles or anything like that.
No, it's not.
No.
So our smile design process is really assessing, having that initial interview, figuring out what is it that they don't like about their smile? How would they like it to look? So I encourage patients to bring photos of smiles that they like. Often they're bringing photos of themselves when they were younger because something's happened to their teeth. And that really shows me that they just want to look like themselves.
They just want to look normal and natural, not like some crazy Hollywood thing.
Yes, and that's very encouraging and positive and something we can create.
Yeah.
And there's nothing wrong with wanting white teeth and having them symmetrical and looking good. And that's not an issue either. But really understanding what it is that the patient wants.
So can you think of any patients where you've had to like tweak the smile design, or like how many tries do you do before you're satisfied?
Right. So usually it's one try because we have a really good conversation and have an understanding. But yes, I had a patient a few months ago who said, no, I really want this Hollywood smile. So I have, a book of different smiles, shapes of teeth that you can look at. And she really wanted this Hollywood look, which is very square, very symmetrical, and all the teeth are about the same length. And she's a younger woman. She's thin. She's, very beautiful. So for someone like that, I think having something a little bit softer is a nicer look, actually.
Right.
But she insisted, so we did a trial smile like that.
Right.
And it just did not look right in her mouth.
It's
obviously
too aggressive looking.
It's too big. It just doesn't fit in. I think that the smile design is correct when it just flows in their mouth. You don't get focused on the teeth so much.
That's right.
So
I know this one patient told me that he has been getting compliments like, hey, did you cut your hair? Or did you what'd you do? And he's like, nothing, it's just me. But nobody really focuses on
the teeth.
Did you get veneers or something?
That is actually, I had a patient yesterday who came back with his trial smile.
Right.
And we do an assessment to figure out, does this, were you happy? So we do the trial smile and you send you home with it for a few days.
Right.
So you can really test it out, show your partner, And he came back and he said, all weekend, people were coming up to me. He goes, my whole life, no one's ever commented on my looks.
Right.
And this weekend, I had so many people coming up to me saying, you look so good.
Yeah.
You look really rested. You look really happy.
Right.
But nobody noticed that it was his teeth.
Nobody can pinpoint that it's like some tooth changes.
And it's a super common comment that I get. And it's a really positive thing. That means it fits your smile. It makes you look good. It enhances you in some way, but it's not so apparent in your mouth. So
right.
People aren't going to be pointing it out to you.
No fluorescent smiles.
No fluorescent smiles, exactly. Yeah.
Well, you did my smile design recently, and I don't think many people have really noticed.
No, you said your husband didn't
Even
notice.
my husband. I mean, he doesn't notice anything, but but yeah, people just thought I whitened my teeth or something but yeah, it's been not a big,
yes.
People aren't like, oh my God, you got your teeth done.
That's correct. Yeah. That's really what you want to get.
Yeah.
Although it's okay if that's not the case. I have had patients who've said to me, I want people to know that I had my teeth done. And I might not agree with that notion, but that's fine also.
Yes.
And if you have teeth that are really, really dark or really, don't look right in your mouth right now before you do this, then it might be noticeable, if you have broken teeth.
Or if you have no teeth, missing teeth, because we have done like Juan, who came in missing bunch of teeth, actually never smiled, and was for daughter's birthday party, big birthday party.
That's correct. Yeah.
And he finally did his smile, and he actually smiled.
He smiled.
And I think, that was nice to see him actually smiling for his daughter's birthday party.
It's very rewarding.
Yeah, and he's been missing that tooth for decades.
That's correct. For a while, yeah.
Yeah, for a long time. So it's very cool to see the transformation in people.
So our smile design process, what you really want to do if you are going to get a smile makeover, whether it's, doing bonding on your teeth or veneers or whatever it is that you're doing, it's a great idea to go to a practice where they will do this trial smile. So they will talk to you. So that's what we'll do, talk to you, figure out what you want, and then I'll design that. I'll take a model of your teeth and I'll design that shape. Looking at pictures, we take a bunch of photos. Sometimes we take videos of you talking. This gives me an idea of how much tooth you show when you're talking, when you're smiling, things like that, which help me figure out how long to make your teeth, how much to have them come out in a forward direction, things like that. Once we do the design, then you come back and we can actually take that, put it in a mold of that design, put some temporary filling material, stick it right over your teeth. So that's where we can do it without cutting your teeth, and we can really kind of assess, does this look good? Is this the look that we want to get?
And you can go home with that and show your partner.
And you can go home with it. Yeah, it'll peel right off, but you can go home and look at it.
Yeah.
Then if we like that design, then you come back and we prepare the teeth to that shape.
Right.
If we're doing veneers, we prepare the teeth to that shape and then make you a set of temporary or provisional veneers that you wear over your teeth. They're also of that design.
Right.
So then you get another extended time period where you're wearing these and you're really testing them out.
Yeah, so the Smile Design really adds a lot of, I guess, safety to getting your smile redone, because I feel like sometimes you go into a dentist and you say, I want to get veneers, and the next appointment, they're cutting your teeth. And there's no like, okay, but what is this going to look like transition? So you just have to like have full trust in that dentist that they're going to make your teeth look the way that you want. But with this, there's an added layer of safety where you can actually see it and you can comment on it before you, or you can opt out. You can just be like, no, I don't want it.
Yeah, you can. You can say, I don't need it, or you alter it until you like it.
Right.
We make changes to it every once in a while. You know, we'll add a little bit of length. Like a case we did yesterday, you know, we did the trial smile. We really liked it. And then we did the preparations and put the temporaries in. And then we decided we wanted to lengthen the teeth just a little bit more so he would show a little more tooth.
Right.
So we added about 1 millimeter more filling material to the edges of the teeth and liked it better. And now we can send that off to the lab and say, you know what, make them like this, but a little longer.
A little longer, yeah.
And we take records of that. So it's not just about you trusting your dentist to know, you know, to give you a smile that's beautiful, but also them understanding what it is that you want.
Right.
So I do the Smile Design for myself, so I can be assured I am aligned with what's in my patients', you know, thoughts about what they want this to look like. So that's really important to me.
It brings the abstract into the concrete.
Oh, sure, yeah.
So it helps. So what are 3 things that you think people should know about Smile Design?
So find a provider that will do a trial smile for you. They'll do a design for you and be able to show it to you by putting it into your mouth. Any cosmetic dentist that is good should be able to achieve this for you.
Right.
Take a look at some before and after smiles so that you can see kind of the types that you can get. There are different ways that you can do this, different translucencies and different sizes of teeth. So that's really a good idea to look at.
Right.
And make sure that you can take your trial smile home if you need to. You know, if you want to show it to your partners, to your loved ones, see a provider that will try that and allow you to go home with it.
Okay, very cool. Smile Design. And it's not that expensive. I think it's like a few $100s to get this extra step done.
Yeah, for sure.
It's like a couple $100. So well worth it.
It is.
Yeah.
Yeah.
Okay, I guess that's it for Smile Design.
Okay, see you next time.
Okay, bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.